My name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. So this is my reaction video to a video that I've seen on YouTube called 5 Ways to Help Somebody Struggling with Their Mental Health from BBC Ideas. I just thought it's an interesting topic. A bit of context, I've treated hundreds of patients with depression, both in hospital that have been sectioned and in outpatient clinics. Just to be crystal clear, I'm in no way I'm in no way criticizing any suggestions that anybody is making about how to help somebody struggling with their mental health. I'm merely seeing if this sort of lines up with my experience of treating people and what other sufferers of depression have said to me. So yeah, don't cancel me, but here we go. Let's see what I think.
You don't know sometimes what to say, and you're basically walking on eggshells.
Sometimes it can shock people. Someone says you're having a good day. They just expect you to say, yes, I'm okay. No, I said, no, I'm not. And some people can get taken aback. Oh.
And I think it's the fear of saying the wrong thing. You know, what do I know about mental health?
I was diagnosed with anorexia nervosa, body dysmorphic disorder, and obsessive compulsive disorder back in 2013. And on Friday the 29th of August 2014, I tried to take my own life.
My name's Hakiran. I'm Sandeep's mum, mother, is it?
Best friend.
And best friend.
Dave first joined the MINT session when he was struggling with his mental health, and from there we kind of, in a strange way, hit it off. I think
It's love at first sight.
I like to think of it that way.
I'm Dr. Will Murcott. I'm a mental health nurse and senior lecturer with the Open University.
For me, listening is at the top of the list. I think that's the first and most important step. If you can, active listening, repeating back some of the things that they've said to you so that they can feel and realise that they're being helped.
That first.
Yeah, absolutely. I mean, it sounds like an obvious thing to say, but listening is really important because, especially if somebody's like, they're worried about the stigma, or they're worried about being judged, or they're a bit embarrassed or even ashamed about their mental health problems, they don't want somebody to jump in and tell them what's going on. They don't want somebody to, to come up with a management plan on their behalf immediately without listening to the problem. Sometimes it's just cathartic to just let it out there, isn't it? To actually, for the first time in your life, speaking it out loud makes it something tangible. So if somebody's doing that to you, then absolutely shut up and listen.
Initial conversation that you had with me when my mum and dad sat me down, that's when the bubble popped for me. That's when I thought at that very moment that someone's noticing how I'm feeling. Someone is noticing and having an oversight of my pain, just asking how you are. It was so crucial and so important to me at that moment.
Ask twice, are you okay? Yeah, I'm all right. But no, are you really okay? And then it's like, well, no, actually, I'm not.
I think there is an urge to try and problem solve and do something. And there's almost need sometimes to be able to fix a problem or a person. And sometimes that's not the right thing to do in that situation.
People aren't necessarily looking for...
I would agree with Dude. I think it depends on the situation, though. I respectfully would say that that's not always the case in every sort of scenario. It's just, more often than not, as I just said, you should be listening. So you should be getting an understanding of what the problem is and the scope of the issue, first of all. But I also think that there's some people who want to be either told what to do directly or if not, then at least directed quite strongly in what to do. So what I'm saying is, you have to judge what you think the scenario is. Is this person just using you as a sounding board to kind of cathartically express their issues, which is fine? Or do they need some active help, in which case, you should put your thinking hat on, I think.
answers. People want to be heard. People aren't necessarily looking for answers. People want to be heard.
Sometimes they're not looking for answers. Sometimes
One of the things I've learned as a mental health professional is that often if I try and set goals or have my own needs and wants and desires for how somebody should get better, they are usually wrong. And so from my point of view, it's working with a person at their pace and trying to understand how they want to move.
You can suggest go to see your GP, you can suggest support groups, you can suggest people taking an activity.
So I was just thinking about what the mental health nurse said before. Yeah, I agree. Obviously, the best kind of path is if the client, patient, service user and the clinician are on the same wavelengths, have the same intentions and goals. I'm not trying to be controversial here, but I'm just talking about from my clinical experience. Some of the patients that I see, it's not as simple as that. So some of the patients that I see have come in because they're really struggling to function. They have these negative cognitions which are associated with something like a chronic psychotic illness or a deep depression. So I guess what I'm trying to say is that I'm not disagreeing with Dude, but what about those people that don't have any kind of plan, that don't have the energy and motivation, that need that extra drive, that need like a high level of encouragement and need a push, I suppose is what I'm trying to say. There are people like that. And I fully acknowledge that I'm talking about the iller end of the spectrum, which is what I see in my clinical practice. I see people who've come in after attempts of suicide, etc. And not always, but often they struggle with getting the motivation in the first place. So you can't be too passive. If you don't show them, if you don't guide them the way through therapy, etc., then there's a danger that you're taking too long to get them better, I suppose, is what I'm saying.
Your GP, you can suggest support groups, you can suggest people taking an activity, you can go and join in that activity with them. So they're not feeling alone with that.
One size does not fit all. You've had a really great idea, didn't you? The family trusted circle.
So what we do, we go out the family environment and go to a coffee shop or just sit there, all four of us, actually doing our pos and negs. What's been your positive for the whole month? What's been your negative for the whole month?
We spend a lot of time insulting each other. We just send each other little videos or, oh yeah, I've been watching that, and just little clips. Everybody's at the click of a button now.
You're in my pocket.
Yeah.
Yeah, I think those are really good tactics, aren't they? So anything that kind of engages somebody, especially if their depression is, I'm aware that I'm saying depression a lot, and obviously there's lots of different mental health struggles. It's just that these particular presentations seem to be more to do with low mood. If that's associated with negative cognitions, low self-esteem, isolation, withdrawal, all of these things are kind of symptoms of the underlying disorder. I'm not saying it's easy to wipe away that underlying disorder, but you can certainly tackle some of those things. So if social isolation is one of them, if low self-esteem, negative cognitions are another ones, then sitting down in a cafe and talking through all the positives will balance that out, and having this kind of communication through videos and WhatsApp will get rid of some of that isolation. Or at least mitigate against it, I should say.
And just little clips, everybody's at the click of a button now.
You're in my pocket.
Yeah.
If they're really struggling and at breaking point, emergency phone lines out there, and Samaritans as well. They need to know that there is support out there, and it's so hard to see that when
you are in a dark place.
When you're in a dark place, yeah.
One of the scary things is that kind of pressure of what do I do if? Because there's nothing more scary than having somebody talk to you about ending their life, harming themselves in some way. Really, the person needs to know as well at what point you will find something acceptable or unacceptable, and then have to do something that involves somebody else. I would try and get that conversation done as soon as I can, to say, look, I will never breach your confidence, but if there are things that worry me, then I may have to do something about that.
So I'm really glad that this video is tackling this issue, because I don't mean to sound disrespectful, but it's not that helpful, I think, to just have a video that only talks about, positive reaffirmation and having a conversation with somebody, and that's going to work and that's going to cheer them up. That does happen sometimes, but especially the clients that I see, there's a kind of darker aspect to that, which is when they're at a stage where their depression or their mental health issues are so severe that there is a risk to life, there is a risk of suicide. And this is an uncomfortable part of it. So what do you do? Where is that step? Because it's quite a big deal to get services involved, especially if the individual is either not consenting or is not fully on board for very good reason. It's a big change in life, isn't it? The commitment to potentially have to go to hospital, to have to get the police involved, to have to see a psychiatrist, etc. But it's important. It's literally life-saving, isn't it? In some situations where you think an individual might be at risk, there is a cut-off point where you might have to go beyond what they might feel comfortable with. And so I think what this dude is saying, the mental health nurse, is that it helps the situation if you let them know in advance, so they're less offended or hurt by you taking that extra step. So that's a very good piece of advice. Excellent. And one that's often missed out, I think.
And that's absolutely okay, because the person will thank you for it afterwards.
Let people know that I'm here and we're going to do this together. So if that means, me and you, we're going to make an appointment at the GP, we'll go together and we'll do this together. And it's about being in the mud together.
You have to keep your own emotional batteries charged up. Because when they're drained out, you can't help anybody else and you struggle to function, let alone just trying to look after yourself. The plane and the oxygen mask, put your oxygen mask on first. Self-care is the number one priority, I think.
You know, it's funny because listening to that as a clinician, that's not something that we're ever really trained to think about, and not something that I ever really consider, or at least not encouraged to consider when you look about how to treat somebody else with mental health issues. Again, I suppose it depends on the individual, doesn't it? So if you are supporting somebody either as an informal carer or as a friend or a relative or spouse, whatever, if it is affecting your mental health, then absolutely you're setting yourself up to go into a kind of negative spiral or negative cycle, aren't you? So if trying to support an individual makes you worse, then that in turn inadvertently can make them worse if you're not able to support them. So yeah, if it's getting too much, absolutely you yourself might need assessment. And I've definitely can think of cases where a couple come to mind of like teenage girls who repeatedly self-harm or have suicide attempts. It really does have just a horrific impact on the family. Yeah.
Put your oxygen mask on first. Self-care is the number one priority, I think.
So I don't think you can actually fail, and that's something that I would really push to everyone who's helping someone with mental health struggles, is you haven't failed, you cannot fail, but you can do something.
Trust your instincts, be yourself.
The right thing is probably what you first felt, and that could have been sitting and listening, just nodding, or it could have been responding, tell me more about that. So not to over-worry, not to overthink, but there is support out there. There are people that will listen to you and give you advice.
The reason I'm grimacing is respectfully, I'm not sure if I agree with all that. I'll explain myself. Because I, through my clinical experience, have definitely seen, not loads, but a handful of situations, families where their instincts haven't actually been that helpful. Off the top of my head, I remember seeing somebody who they were from a Asian community, and the man, so there's a man, trying to think, who's in his 30s, and he was developing this psychotic disorder. He was getting all these paranoid kind of ideas, and the family's way of dealing with it was to literally like that's not true, but like house him in this like shed at the end of the house in the garden, hoping that it would go away, and he would literally be taken food by this like sort of servant kind of guy that worked with the family. And then the guy ended up becoming a lot more mentally ill and psychotic, paranoid. He ended up stabbing this person who's delivering him food. I know that's exceptionally rare, but I suppose my point is that I think it's respectfully an oversimplification to trust one's instincts, because not everybody has good instincts. And again, I'm saying that because I've seen it happen myself. I think that actually, to mitigate against that, you should get as many people as the individual wants involved, but having more perspectives is less likely to lead to this kind of strange behaviours I've just described. And also, you need to get professionals in at an early stage if somebody has serious issues, I believe. So yeah, I'm a little bit unsure about trusting one's instinct always.
And guidance.
And it's important to talk. Oh my God, it's so important to talk.
Very important to talk.
We had most chats with...
Again, to a degree, in some situations, yeah, I think it's important to talk. I've also definitely treated some people who don't want to talk about their mental health issues. So again, if it's kind of low mood and you need some positive affirmation to get your life back on track, absolutely you should talk. If you're starting to become slightly paranoid or psychotic, I don't know if talking actually helps. I think that can worsen your symptoms, and moreover, it could sow seeds of distrust between you and your family members. So yeah, it depends on the situation.
So important to talk.
Very important to talk.
We had most chats with love you, man. You know, it's good to have someone like Josh in my life. It makes my life better.
Okay, so yeah, my overall views were that it was a pretty decent video, and they got some things right, definitely, or they did some things well, I should say. They didn't seem to kind of focus on specific, relatively easy fixes or like fairly simple to organize activities that might help with somebody's low mood or poor mental health, like encouraging exercise, like getting them to do specific hobbies where there's more of a social interaction, whether that's human contact or just going for walks, meditation, mindfulness. These are when I say easy, I mean they're easy to access versus getting a GP's appointment, getting a psychiatrist appointment, starting on antidepressants, that kind of thing. So I'm a bit surprised the video missed that out. Yeah, as I'm sure you've picked up from if you've been watching this video, there's a couple of things that I think are very specific to scenarios, and could actually be a bit harmful, I think, in other scenarios where there's mental health issues, which is why you need professional help, I think. And again, this is not me just trying to be controversial. This is speaking from cases that I've seen as a psychiatrist. But anyway, that's what I think about this particular videos. Let me know if I've got it completely wrong. Let me know in the Shmom and Shmection below. Let me know if there's any other videos you want me to react to. So I'm a forensic psychiatrist, so as well as mental health, I'm also an expert in criminality. So it can be true crime or criminal cases. Let me know in the Shmom and Shmection. I'll put some links to some videos related to this topic in the description. So go and click on that. Until then, have a blessed day, and do not forget, I love you.